Welcome to today's session, everyone.
We are PreMed CC, a student-led organization established in the fall of 2021.
Our goal as an organization was to create an online program for pre-medical students at community colleges and universities, with the hope of guiding the next generation of diverse and inclusive physicians.
And while we advertise our organization as being for community college students, our events are open to anyone.
We realize that finding guidance and mentorship in a pre-med journey can be especially challenging for first-generation pre-med students,
people that lack the financial resources, or just those who do not know people in the medical field.
One of the best parts about our events is that they are virtual, so you can do it from the comfort of your own home.
We typically have events on Fridays from 5 p.m. to 6:30 p.m. Pacific Standard Time, and on Saturdays from 11 a.m. to 12:30 Pacific Standard Time.
If you aren't able to attend the event, all of our sessions are uploaded on our YouTube channel.
Many of our sessions will end up with a Q&A with the speakers.
Any questions that you have, you may put it in the Q&A session on Zoom, and our team members will read them and have them answer.
After you have attended our event, you can log into our website and complete the quiz, which will contain questions pertaining to our session today.
If you score 70% or higher on the quiz, you will be awarded a certificate to show that you attended our session today.
If you want to stay connected with the upcoming events or just want to tell your pre-med friends about the PreMed CC, you can find us on Facebook, YouTube, Instagram, and TikTok as @PreMedCC.
All right, everybody, thank you so much for being here today. We're excited to have our speakers here. Without further ado, I'll go and introduce who we have here today, and then we'll get started. So with us, we have Dr. Michael Walls. He is the National President of AMSA and a recent graduate of Touro University, California. He joined AMSA in 2014 as a pre-med at Cal Poly San Luis Obispo and first got involved nationally on the health policy team in 2017. Dr. Walls was drawn to AMSA because of its dedication to creating physician leaders and for its long history of advocacy, not just for future physicians, but for its dedication to create equitable access to healthcare for all patients. Michael has a strong personal interest in healthcare access, medical education reform, treating substance abuse disorder, and making change through systemic policy change. He will be starting emergency medicine residency at George Washington University this summer. He's currently living in Connecticut and enjoys rock climbing, home brewing beer, and hiking with his fiance and 2 dogs. Also with us today, we have Ms. Siva. Ms. Siva is a 4th-year medical student at Eastern Virginia Medical School and is serving as the president-elect this year at American Medical Student Association. So soon to be doctor, congratulations. She joined AMSA in 2017 as a medical master pre-med student and honed her skills in advocacy. She is passionate about reproductive health issues and policies ranging from anti-human trafficking efforts to advocacy around abortion access and affirming care for LGBTQIA+ individuals. She wants to continue working on medical education reform, especially in trauma-informed care and interventions, reproductive justice, and public health policies. In her free time, Ms. Siva loves working on her micro art, hiking, and baking. Thank you guys so much for being here. And go ahead and take it away.
All right, thank you so much, and good afternoon, future doctors. I'm really honored to be here with all of you today and to share my journey to becoming a physician and to being a part of American Medical Student Association, or AMSA. My hope is that by sharing my story, I can inspire for you to continue pursuing your dreams despite any obstacles that may come your way. So I was an immigrant. I was born in India in a small city called Bellary, which no one ever knows about. And I moved here when I was 8 years old. And I moved with the dream of becoming a doctor, especially because I grew up with both my grandfathers were doctors. When I came here, I attended Johns Hopkins University for my undergrad, and I graduated with a degree in public health. However, it was a huge struggle, especially with low self-confidence and doubts, especially when your pre-med advisors tell you that you will not become a doctor. And you can imagine how disheartening that was for me. And All of us, we're here because we share a vision of becoming and working as physicians, driven by the desire to heal, inspire, and improve the world around us. But on the path to becoming a physician, there will definitely be times when people bring you down, when you face doubt and you feel like giving up. But in these moments, I think it's when it's very important for us to hold on to our beliefs, in our belief in ourselves, as well as finding a community that believes in you. So I took a year to recoup, and then I went to Dartmouth Institute for Health Policy and Clinical Practice to get my master's in public health. It was there I had this really great opportunity to shadow life care nurses. They went on home visits, and that really reignited my dreams and passion of pursuing medicine. I gained very valuable lessons from the nurses who taught me the significance of fostering a meaningful provider-patient relationship. And the same lesson was instilled in me by my grandfather, and that was the main catalyst that sparked my desire to pursue a career in medicine in the first place. And so I started the long process of medical school applications, and I was rejected the first time, every school. And that was, again, a very difficult time, and I began to doubt myself again. But I decided to apply for a medical master's program at Eastern Virginia Medical School that would further bolster my application. So that led me to Eastern Virginia Medical School, where I am now currently. And it was a one-year program for pre-meds, and you would have a direct access into the medical school if you do well enough, which I thought I did, but again, I was rejected. And again, it was the same cycle of, self-doubt and low self-confidence. But I had a really great opportunity when I was at EVMS to join American Medical Student Association as a pre-med. And that's when I realized that I really, really wanted to be a part of progressive change. I wanted to be a physician leader and wanted to get the tools to advocate for my patients' rights. The truth is, we can send our patients home with prescriptions to medications, but if they can't afford it, because the big pharma has put exorbitant prices on these drugs, or if you tell a patient it's very important to go exercise, but are we taking into account the built environment issues? And you can tell your patients to eat healthy, but what if they live in food swamps or food deserts? Medicine must transcend these barriers, and to do so, we need future physicians to become advocates, and AMSA really showed that path for me. Lo and behold, after years of applying for medical schools, it paid off, and I am getting my MD degree in just a few short days. But throughout my years at EVMS, I served as co-president of the EVMS AMSA chapter for 2 years, co-chair for the Just Medicine campaign for National AMSA, and now as the president of AMSA. And I can say that, I know my grandfather would be proud of me, and more importantly, I think I'm proud of myself for choosing this path that allows me to advocate fiercely and unapologetically for my patients, for everyone. So to all of you future doctors out there, I would encourage you to never give up on your dreams, no matter how difficult that journey would seem. Believe in yourself, your abilities, and seek out a very supportive community that will help you along the way. AMSA is and always will be that community for me, and I'm so grateful. If you want to join and connect with like-minded medical students, pre-medical students, professionals from all over the world who are committed to achieving equity in medicine and to learn from physicians, experts, innovators, come to Future Physicians for Change. It's our annual convention. It's being held in Phoenix, Arizona, June 15 to 17 this year. It's a 3-day event. It offers unique opportunity to be a part of a community that's reimagining, revolutionizing healthcare, while also having fun and networking. So I hope to see all of you there. Thank you.
Awesome. So to reintroduce myself, my name is Michael Walls. I actually realized that we sent bios from 2 weeks ago, and in the 2 weeks since, Rohini is now the national president. I'm immediate past president, so that's on us for not realizing that. But I think, listening to everything Rohini said, it's really funny how we took fairly different paths to get through medical school and ended up in more or less the same destination, which I always think is really funny. But So I grew up in San Jose, California. I was one of those, 5-year-olds who was like, oh, I'm going to be a doctor when I grow up. And I kind of just never changed my mind. My mom was a nurse, so I think that probably influenced a lot of it. And then my dad was a respiratory therapist. So I was always like going medical. But so when I ended up going to Cal Poly San Luis Obispo, sort of halfway between SF and LA, for those of you non-Californians, fairly small school. I was a biochemistry major. Admittedly, I did not have the best grades. I'm going to make up numbers a little bit because I don't remember exactly, but I was like 3.4 GPA. Like I did decent on the MCAT, like 5. I'm not even going to pretend I know. But anyway, so I sort of went through undergrad. I did some of the extracurricular stuff, but what really helps me get into medical school really actually was AMSA. So AMSA at my undergrad was kind of the like how to get into medical school. It was sort of like the PreMed club. And through that, like all of the people in my local chapter who helped us like learn like the pathway, like when you need to take the MCAT, when you need to apply, when to get letters of rec, who to get letters of rec from. So AMSA really to me started off as that like networking, finding mentors, even from classmates just a couple years older than myself, and really helped me like formulate that plan. I did not take a gap year, which I generally don't recommend having done it. I can give advice if anyone has questions on it. But part of that rationale was I had to take the MCAT at the end, like the last quarter of my third year. So I was studying for the MCAT while taking neuroscience, physical chemistry, and metabolism. It was terrible. I don't remember that quarter at all. Because I was just studying. So that's the biggest reason I don't recommend it. But I did end up getting in to medical school on the first try at a DO school at Touro University in California, sort of like North Bay near San Francisco. Did a dual degree, so they have a DO and MPH. They do it kind of weird where the DO is integrated into the curriculum. So I took, the MPH is integrated into the DO curriculum. And so I did some summer classes that were specific to MPH and ended up being able to do both in 4 years, which I also don't necessarily recommend because, especially having not taken a gap year, I just went straight through and pretty much didn't get a break for 8-ish years. So anyway, I digress from that. But going through medical school, I think AMSA again was sort of that, like I was never, like I said, my GPA in undergrad wasn't great. And so I was never really like, I was never top of the class. I wasn't acing all of my tests. And to me, that wasn't that important because similar to Rohini, I think a lot of what we need to do in medicine is focusing on, the patient in front of you might come in with diabetes and asthma. And I can give them insulin, I can give them an inhaler, but beyond that, there's not much I can do if they live in a food desert or if they live in a place next to the freeway that exacerbates their asthma. And so those sorts of things, like I was more focused on how can I help those patients. And so to me, that was easier to do in something like family medicine, emergency medicine, internal medicine, where you're sort of in that like more direct primary care, seeing patients, that often have not had exposure to the healthcare system. And so I didn't need to focus on those scores. And I really looked to AMSA as how can I get involved in that, in making that change. And I became a big believer in making policy change, which a lot of people not laugh at me in a bad way, but as like I don't want to do that. I'm glad someone does. But to me, I think it's like the policy is a specific interest of mine, but I think the advocacy piece is something that all medical students need to be involved in. So that doesn't necessarily need to be, out on Capitol Hill protesting and talking to your representatives about every issue that comes across. Some people do that. We definitely need people that do that. But advocacy as a medical student, as a pre-med, even a pre-med as you're shadowing, or if you're volunteering at a hospital, can look like asking just simple questions about why their asthma might be so much worse than that patient you saw earlier. And it might not be a question that physician, that PA, NP, that they've thought of, or even, when we put in GFR, looking at kidney functions, there's a question on not all, but most electronic medical records that says, is the patient Black or African American? And that actually, I forget which direction it goes. It says that their normal level should be higher, which actually makes it more like or less likely that they receive a kidney transplant when they realistically need it. So simple questions like asking why does it ask about the patient's race? Medically speaking, it makes no difference, but there was a study like 20 years ago that suggested there might be, that has since been disproven. And even just asking that simple question is advocating for that patient to say, like, take a deeper dive into like, why are we actually doing this? How is this impacting the patient's care? Because it's not like it's done maliciously. It's most of the time it's just a button on the computer. But just asking that simple question can be so vital to the patient care you're providing. And to me, AMSA was sort of that way to learn about like what those issues are. I never probably would not have heard about GFR, pulmonary function tests, like looking at the lungs, all of these different tests that look at race in a clinical algorithm when it doesn't need to be. And AMSA taught me not only to identify and be able to look at how issues are impacting my patients, but then also how to do something about it. And like I said, I went the direction of, I'm going to be, talking to the White House about all of these important issues and why things like Build Back Better, what became the Inflation Reduction Act, why so many bills or so many provisions in that bill were so important and how they impact patients. But it doesn't necessarily, you don't necessarily need to go that big. I think as long as you're advocating for your patients, and in particular, the one sitting right in front of you is always in that moment the most important person, can do a huge amount both for the patient in front of you, but even as pre-meds and as undergrads or at community college, when you're applying for medical school and then eventually applying for residency, they take notice of things like that. So especially like I was in AMSA, I joined 2014 just as a normal member and worked my way up obviously to now immediate past president. But every med school interview and every residency interview, I was asked that about AMSA several times. And it was because, to me, that was how I showed dedication and advocated for my patients. But that's what they like to see. They want to see that you have a passion for something in particular, that you're sticking to it. And especially if it's something serving the community. If you're, working at the homeless shelter through community college, you go to a new city and then you find another homeless shelter, like that's something that's really going to stand out. And it's going to, in part, give you a very unique perspective that most medical students are not going to understand about unhoused communities and the issues facing that very specific community. But it's also going to show that you're dedicated to the cause and that you want to make change. And so, Rohini talked about Future Physicians for Change, which I think is going to be one of our best events. Like, we haven't really had that in-person event for a long time. We did last year, but it was sort of smaller. And I think, being able to connect with other pre-meds, with medical students, identifying mentors. I still talk to, oh my goodness, from my first year, first time going to convention, I still talk to probably a dozen or so people that I met in the 3 days that I was there. A couple of them I continued to work with, so I guess I have that little extra excuse. But there are a couple that I met and I keep in touch with, some who left medicine, some who continued and are now, finishing up residency, or a couple have finished residency and are practicing physicians. But sort of that networking component of like, just being able to have someone to ask questions of like, what resources did you use to study for the MCAT? Or like, how long did you study for? Like, all of those things are difficult to know, especially if you're a first generation pre-med or want to be going to medical school and would be the first one in your family. Those are difficult questions to know the answers to. I'll drop the link if I'm able to, but AMSA actually also just released a pre-med guide to getting into medical school, specifically geared towards first gen medical students, or first gen pre-meds, I suppose. I can drop that in there. It's by no means comprehensive, This is intended to be something that we want feedback on. So if you're like, hey, you forgot about this one thing, like, can you include it? We're 100% going to include it, assuming it's correct. But being able to find medical students to help mentor you and get you through those applications can be huge. And as someone who's mentored pre-meds, it's not a very big lift for us. It's really as simple as an hour phone call that answers 1,000,001 questions, and then the occasional text after that. So it's not a burden on your mentors. It's really something that 99% of us are really happy to do because we understand the struggle. But I've been talking for a little bit, so I will pause there and see if there are any questions or if Rohini had anything else to add.
No, yeah, I think the toolkit, that was a great idea. So we're building a pre-medical pathway toolkit so that it would be helpful for first generations, especially if they have any questions, it would be addressed there. And I completely echo what Michael said about advocacy. It starts, with the person right next to you, and then you build it up. And that's exactly what AMSA teaches us. It goes from, okay, we'll question why this is happening. And then you start building different tools, from bird dogging to phone banking to talking to the Surgeon General about, what we can do better for healthcare worker wellness. And we've done that. We've just had a panel for that as well. So it's just about starting to raise your voice against for something. And I really hope that we can answer any of the questions that you guys have, and hope to see you guys at the AMSA convention.
Yeah, and the current Surgeon General was actually in AMSA when he was in medical school.
Yes, that's right. Yeah.
So was Dr. Jha, who was let me see if I can get his title right. He was the White House policy advisor on COVID-19 response.
Yeah, he's the dean of Brown Public Health.
And I think even the Planned Parenthood president at some point, she was the AMSA president.
Yeah, Dr. Leanna Wen.
Yeah, she was an AMSA president. Yeah, Dr. Wen. Question: can you guys talk about what opportunities for pre-med students in AMSA are available, and what opportunities are available for pre-med students, both as just regular members, but also leadership?
I can talk about it a little bit, and Michael, please feel free to jump in. So we have a pre-medical mentorship program. It's a scholars program, and it's also meant to really answer any questions you have, help you along the way, from MCAT training to all the way to, how do I do this how do I write this for applications? We also, the toolkit which we talked about, there was one more thing that I wanted to say. Oh, for how to get involved as a leader. So we have a bunch of positions, national leadership positions that are open. So we have action committees and campaigns. Action committees are usually for long-term advocacy, such as we have global health, wellness and student life, gender and sexuality, community and public health. And these are positions that focus on those topics. And you could either be the chair or the coordinator for those positions. And then you have campaigns, which are more short-term initiatives that we take, such as Med Out the Vote, or we have Just Medicine, which actually turned to Farm Free, and Med Students for Gun Safety, things like that. So if there's anything that you're specifically interested in and want to do more advocacy, learn more about a topic that you want to just be a part of, that's something that we can accommodate for all the members too.
Yeah, so to Rohini's point, a lot of the national leadership positions are open to pre-meds. There are a couple that are specific for medical students, but most of them are available also to pre-meds. Probably, so I saw someone just dropped in the chat, the pre-med scholars program. That's one of our, so we have scholars programs that run, Rohini might need to correct me on when exactly it is, or I could click on the link, but they run either in the fall or the spring, spring meaning from like January to April, so I guess it's more winter, but to sort of walk through like that whole process. So a lot of the things we talked about, how to get in, when to take stuff, advice from a number of speakers. Kaplan helps with that course as well. And we do have a partnership with Kaplan. But arguably the biggest thing you can do to get involved with AMSA is just start a chapter. So especially if you have groups of friends, groups of people who are interested in going into medical school, we have chapters. We have a couple at community colleges. We have a lot at four-year colleges as well. But in terms of actually setting it up, it's actually super easy. So the biggest thing is having at least 5 members. So joining AMSA on the national level, which I can drop the link for that in the chat as well. So having 5 people who are AMSA members and then filling out a constitution and bylaws, which we kind of just give you, and you write your name and your chapter and answer a couple questions. And then once you've done that, you're a chartered chapter. You have access to everything from like our FIGS discounts. FIGS are like nice fancy scrubs. But you can also, you'll get in contact with, this year it'll be Tyra Lee. She's our pre-medical trustee. So she sort of coordinates all of our pre-med chapters, which is no small task. But she'll give you all the information on upcoming events. If you have an idea, you're like, we really want to do something on reproductive health, whether that's, a skills training like a manual vacuum aspiration, which is when you perform an abortion on a papaya. Not really perform an abortion, but you know what I mean. Or, you want to do clinical skills like suturing, which we partner with the Army to help with. So any of those things, Tyra, sort of this year and in future years, it'll be someone else, will be your primary contact to help provide you with resources, point you to people like other chapters who've done something similar, put you in contact with any of the action committees if they have, like we have a National Primary Care Week that always has a lot of events and education going on. Health Equity Week of Action, things like that. So they'll keep Tyra and the pre-med team will sort of keep you up to date on what's going on. And then if you have ideas, that's kind of why we're here, is to help you put together events. We've done it at hundreds of chapters, so there's no reason we can't do it at your chapter. And so that's probably the easiest thing to do is start a chapter and just think about like what your campus needs and see how you can fill that gap, particularly when it comes to pre-meds.
Yeah, and in early fall, I will be doing a talk on how to start a pre-medical chapter. So we can do that. We can talk about it more. I'll connect you guys with Tyra Lee, who's our pre-medical trustee, and we can figure out how to do that if that's something that you guys are interested in. But to add to Michael's point, we're also very big on medical education reform. If there's any gaps that are not being filled either in your schools or, even in medical schools, there's a lot of gaps in our training. So AMSA usually fill those gaps for us. So we don't have undergraduate medical education for abortion training. So we don't get a lot of access to that. And especially as someone who wants to go into OBGYN, I really wanted that training. So that's where AMSA came in. I had our whole EBMS, we hosted a MVA training, which is the manual vacuum aspiration training with the papayas. And also we did that at the AMSA convention last year. So that was really great to figure out how to use all those different tools and what to do. And they also do IUD trainings and how to insert IUDs. And there's so many hands-on training that's available. And suturing, which is always a really great skill to have, no matter which field you end up going into. So yeah, there's just a whole lot of stuff. And if you guys have any specific questions, please let us know, put it in the chat, and we're happy to answer it.
That is, very empowering, and it's amazing what is accessible and what you can do if if you choose to start a chapter and become a part of AMSA. One question, it can be daunting, maybe some of this. What does it take for a pre-med student to be a leader? What skills they need to have, say, to want to start their own AMSA chapter and be successful?
Passion, I think, is the only real skill. And that's not, everything else we can help you set up, teach you different advocacy methods and tools. Everything can, we can help you with all of those things. But the only thing that you really need is that you really want to start this, you want to advocate for your future patients, and you're just passionate about any of the topics that we mentioned and anything that AMSA is supporting. But I don't think there's really anything more than that. What do you think, Michael?
No, I agree. I was the biggest thing that I tend to say, and it sort of falls under the category of passion, is being able to follow through. To be totally honest, like I think I kind of alluded to this earlier. I'm not the smartest one in the room. I'm not terribly creative. I'm not like, I don't consider myself like the best at anything short of, you know, what I've really dedicated myself to. But I say that not to be a downer, but as like, you can do everything that you want to do, even if even if you're not the smartest or not the most outspoken or not the most creative. Really being able to, you know, look to your community and see what your community needs, which everyone can do for the community that they live in, especially, or at least if they've been there for more than a few months. But recognizing what your community needs and then just wanting to do something about it. So building off that passion is, you know, if you have a passion for helping your community, you're going to follow through. You're going to do what's needed to help your community. So, you know, I think in terms of what it takes to be a leader, I think listening, so seeing what your community needs, listening to what people are asking for, and then acting on that. So it's always that, like, listening with the intent of acting on it as opposed to just responding. There's another phrase for that I can't remember off the top of my head, but yeah, I think everyone has the potential for leadership. It's really just a matter of, are you willing to listen, and then are you willing to act on that?
And you know, it is a daunting task to, you know, undertake all these different advocacy efforts, like, you know, for abortion access. Things are politically so, for lack of a better word, messed up. And, you know, we want to talk about that, and we do that at AMSA, and we don't sugarcoat anything. Everything's evidence-based for us, and we talk about what is, again, for lack of a better word, the right thing to do is, you know, bodily autonomy is something that everyone should have the right and access to. So for things like that, and we can always help you guys. I mean, that was something that was daunting to me, because I had to start educating myself of the different policies that are there, what's happening politically, what can I do, what my role as a medical student could be in this advocacy space. But we can help you with all of setting all of those things up. And again, it's just, I like what Michael said. It's about listening and then following through. I really like that. And I think I kind of disagree with him when he says he's not the best. So he was one of the best presidents. So
it is really amazing in the sense that, you know, AMSA is facilitating, you know, your ability to get involved, because, you know, speaking from experience, it's a lot, you know, what is the best way to help the community, and your community could always use help, but it's hard to know exactly what that is. And this is a, you know, perfect way for people to get in tune with that and be able to do something about it. Michael, you made a comment about you know, not being the smartest one in the room, but just being dedicated, you know, to what it is that you're doing. And Ms. Siva, Rohini, for you as well, if you guys could elaborate on that, you know, given your journeys, what do you think has been the most important attribute that you have, you know, resilience or grit or whatever it may be that has brought you here?
Oh, that's such a good question. So I think part of it for me is admittedly a little bit of like mild OCD, is like when I'm asked to do something, like actually doing it. I think so that was something I really had to learn, that I was not great about in undergrad and even parts of medical school, was being able to understand what my own limits were and setting boundaries for myself. So even if that's like, oh, this sounds like an amazing opportunity, I would love to do that, but I also have, you know, research and class and AMSA and advocacy, and I have like this laundry list of things to do, is being able to say like, I wish I could, but I really can't. I think once I learned that was when I really felt like I was able to do things really, really well. And that was when people started to recognize like, oh, Michael, like I asked Michael to do this and he did it. And so I don't think it takes anything special, but being able to set those boundaries, which is very difficult, especially when you're like, that sounds like so much fun, or it sounds so cool, or it'd be great to put on a resume. Like what I had mentioned earlier was like showing that like dedication to one thing. So instead of having one of those resumes that's scattered, where it's like, you know, I'm volunteering a couple hours here and a couple hours here, and I'm doing a couple hours of research. Instead of doing all of that, that was what, especially probably the first 2 or 3 years of my undergrad, that was what my resume looked like. And then as I sort of found AMSA and I sort of made that connection, I probably honestly was one of my mentors who I shadowed as an undergrad. Like I really started to consolidate that, and I wasn't volunteering. I still did a couple hours volunteering because I enjoyed it. But I cut back on a lot of the hours I was doing there, and I really focused on like, how can I do really excellent work with AMSA? And so I think it really doesn't take much, is just like being able to understand your own capabilities and time.
Yeah, it really is such a great question. I think for me, it was pretty much the same thing. I had to choose a few topics and few areas that I was very, very interested in and really wanted to dedicate my time to. And for me, that was, I worked a lot on anti-human trafficking efforts all throughout my undergrad, grad school, medical school, and still hope to. And the only way I got into that was I just randomly read a book when I was between my first and second year of college, and it was Half the Sky. I don't know if you guys have seen the Netflix show. I think it became a documentary series as well. But I read that book, and it was very, I never realized the extent of the human trafficking issue. So that led me, I looked up one of the organizations that the book was talking about, and I went to India and I started volunteering there. And that's how I really think I got into advocacy, by understanding what the problem was, and then being resilient enough to like really want to do something in that area, being cautiously optimistic that something can change if I'm also involved, and adding my voice to the efforts that are already being done, and what can we do better. So I would say kind of choosing the areas that you're really interested in, because that does show in your resume. It always comes through. Instead of doing like lots of volunteering, research, everything, if there's some topic area that you're very interested in, focusing on that and really putting your heart and soul to those things. I will say that I also didn't have the best GPA in undergrad, which is probably why they told me I couldn't get into medical school. But at the end of the day, I got into my MPH program and subsequently my medical school because I never left those volunteering efforts or those advocacy efforts. It was always in those topics that I was very interested in, and that stayed. So I think that's also my answer. Yeah, similar.
That's I mean, it's very, very powerful hearing that from you both. I think as, pre-med students, at whatever stage that we're in, and the people here watching, it's what can I do? What can I grab and put on my application to make my application stronger? And I'll do this and I'll do that. And you spread yourself so thin. And, your story specifically is the exact opposite of that. Is, what you guys were saying, following your passion and sticking to one thing that you truly care about was, that overcame any of the things that we're usually putting the carriage in front of the horse, as they say, right? So on that topic, another question for both of you, this policy change and advocacy also can be really daunting, because I'm sure once you're doing it, there's a lot of walls, right? A lot of big walls. So how do you guys keep yourselves going? That everyone has that burning passion at first. How do you keep yourself going? The challenges, fighting against policy change and patient advocacy.
Another such a good question. There are times, I will be honest, there are times when it gets very challenging to keep that same burning passion, because you want to see change and you want to see that as soon as you can, and you hope that others can see what you're saying. But it's that being cautiously optimistic. You understand the challenges, but you're still optimistic that you can make that change, if you reach enough people. So just us having this discussion, it shows that if like-minded people come together, if you find a community of like-minded people, we can make that change. And it just begins by finding your community, your people, and finding others who share the same passion as you. So that, because one voice is great, and I do believe that one person can make a change. but when you go together, it's stronger, and people will have to listen to you. And we've seen that. We've seen those things happening where, at AMSA, when we go together for something, people really do listen. They ask us for more information. They want us to, endorse the bills that they're putting, any policies. So we're reached out to on a daily basis for this. And that gives me hope that the work that we do really does make an impact. So, but it can be daunting and it is challenging at times, but that cautiously optimistic piece keeps you going.
Yeah, I mean, I love all that. And I think that sort of adds to the point as like a lot of students, so a lot of undergrads and even a lot of medical students feel like they are not expert. Like this is sort of that curse of like the more educated you get, the more you understand how little you know. I think I said that right. So medical students and pre-meds have a tendency to think like, oh, I'm not an expert on the Affordable Care Act. Like I'm not going to go talk to my senator or my representative about this bill because I don't know enough. But I would argue that purely by sake of being in healthcare, of either going down this path or trying to go down this path of dedicating your life to helping others, does make you an expert. So when I go and I talk to representatives, so I'm in Connecticut, I met with, oh gosh, I just blanked on her name, Representative DeLauro. And I did not go and I talk about specifically about the policy or like, I referenced at that time, we were talking about environmental health and I was looking at guidance from the European Union on what like fine particulate matter and like what's an acceptable level. I know nothing about that. I couldn't tell you any of the science. I couldn't tell you like why they set the limit at 8 instead of 12. Like that to me is like very technical that I don't fully understand. But I trusted the CDC and the EU as like these are the recommended guidelines. Where I added value to that conversation was talking about the patients that I saw on a daily basis. So when I was practicing in California, when I was a medical student in California seeing patients, I was at in Salinas. So like for those of you who know Salinas, it's a very migrant farm worker heavy community. We were at the county hospital, so we saw even a greater proportion of the migrant farm workers. So a lot of monolingual Spanish, a lot of people working in the strawberry fields who are inhaling, strawberry field dust on a daily basis. The amount of valley fever we saw was kind of ridiculous. But like, that's where I can add the value is like through the experiences I've seen in the community. And I think this is where being an advocate and a healthcare professional can be so powerful is I'm not here to tell you that like this specific technicality in the policy is the important part. What I can tell you is that this is what I'm seeing in your community. This is what I'm seeing affecting your constituents. This is how this specific change will impact people. So seeing reduced rates of valley fever, reduced rates of asthma, like through simple changes. And, that's probably not even the best example for particulate matter because that tends to be a little bit more of like the industrial stuff and not necessarily in the fields. But using that sort of barometer to like how we can improve air quality and how that will impact the patients I see on a daily basis. Like those are things that our representatives, that their staffers know very little about. They can talk to you about the statistics and like, 20% of our constituents have asthma, but I can tell you about, this is a patient I saw on Monday. This is a patient I saw on Tuesday, and just go down the list of like, this is the real impact that the policies you're making are how they're impacting the community. And so we all have those experiences, whether it's personal, whether it's through, work as a medical student or volunteering at the hospital, working at the homeless shelter, like any of those things, you have experience that is valuable and that you can be an expert on any of those issues. I kind of admittedly forgot what the initial question was, but I think that's sort of like an important note is like, the policy issues are not always going to work out in your favor. But as long as you're keeping in mind, like the patient you saw and advocating for them, that's sort of what keeps me going.
No, absolutely. I mean, there's amazing responses. Brings to mind a few things, Rohini, when you were speaking, like so many epithets about, one small step at a time. Rome wasn't built in a day, right? You can't get down on yourself because you didn't see immense change. It's every small interaction with people that counts. And all more to your point, Dr. Walls, it's we get into this illusion that we have to have expertise to be able to speak on a subject, and I speak for the people in the chat and all of us as well, that like, oh well, I'm just a pre-med student, or I'm just a ER tech, I'm not sure, but you can share your experience. That's what matters, and it can go a lot farther than you might think. You guys have very, very impressive resumes. So a question for you.
I just have one thing to ask about about leadership, is that I think leadership is not something that you learn in a classroom or that you have an innate talent for. It's something you just have to get up and do. I mean, you have moms and dads who became advocates because their children were murdered with guns. You have parents that become advocates for these like diseases that are like very obscure, but and it doesn't take talent, it just gets up by actually giving I was gonna say the other word, giving a crap and actually doing it. And you have to do it. It's not, and you have to be somebody that has a very thick spine, because you're going to get doors slammed on you, just kind of like in your pre-med journey, where you take that OChem exam and you don't do as well, and then you have to get back up and do it again and do better on the next exam. And so I think that's just life. It's not, we all don't, we're all not Julius Caesar, Alexander the Great, or any of those leaders. It's just that you just have to get up by doing it. And I mean, yes, some people have certain talent, and just because you don't have that talent, like some people are great orators, and yes, you don't need to be an orator like Barack Obama to be a leader. You could do other things. There are a lot of great leaders that are not great orators, and so they kind of do things behind the scene and so leadership is not just the person standing in the middle of the stadium giving a speech, but it's all the other little actions that happen to make those things happen.
No, that's so right. I just wrote down a few things I wanted to say about that. First, what Michael mentioned about, it's your experiences and what you bring to the table. How you put your experiences forward and the way you tell your story, that's what legislators want to hear. That's what really makes a difference. No one cares about the statistics. I mean, of course, it's something that's important and they'll put it down, but that's not the most powerful thing. Everyone can look up what the statistics are, what the facts are, but it's the story of your patient. That's what people are going to remember, and that's what will probably push that bill forward too. And then for the, if you're not, the best at something, that's okay. I'm not a very good public speaker and I know my limits. So I write down everything. And I was talking to Michael just before this and I was like, oh, are you writing down a speech for this? And he said, no, I'm going to go off the cuff. I was like, oh, well, I cannot. And so I wrote down everything. And it's okay. It's okay to do that, to know where your limits are and to work on those. Doesn't mean that it has to stop you from doing anything. And then about organic chemistry, I hated that. I failed it in my undergrad, and then I still going to be a doctor, so it's okay. It's all going to work out.
In reference to, I mean, you guys have mentioned a few times in your responses, like it's really important to know your limits and to put your energies into what you can do and do it well, as opposed to being spread thin. So in terms of what you guys enjoy in your personal lives, whether it be hobbies, how have you been able, what's the golden key? Like, what's your secret to being able, to do these and have these amazing resumes and still be able to take care of yourself, whether that be mentally, be around family, so on and so forth?
Yeah, I mean, I think this is one of the most important questions, especially like in the medical field, with burnout or whatever you want to call it being like such a huge issue that like you need to take time for yourself. When I was in medical school, I don't remember far enough back to undergrad to be totally honest about what I did. I know I rock climbed a lot, which was great for my mental health, and I still rock climb. But in particular in undergrad, it was one of those things, like if we had a test on, like I designated one day a week. I was like, I'm not studying. I'm going to go do whatever I want, which if that day was, I'm going to sit on the couch and play video games until 3 a.m, or I'm going to go on a hike, or I'm going to go to the beach, or I'm going to go rock climbing again. Like, I always tried to set at least one day a week where I was not doing anything studious. So I was not doing AMSA. I was not studying for the next test. I wasn't refreshing on old material. It was a day just entirely for myself. And I think that was something I learned from, my older classmates, the ones who were already married, had kids, had family. They were the same way. They would always say, like, every Saturday evening like they would set time. They're like, I am hanging out with my family. We're going to go to dinner. We're going to cook dinner together. We're going to bake a cake. So I sort of took that from them and was like, that's something, they have kids, so they have a little extra responsibility. But that doesn't necessarily mean that I can't do the same thing and take the time. Like, if they can do it, having the extra responsibility of kids, I can do it having no other responsibilities aside from my dog, who's relatively low maintenance. So I think that's one of those things. Like, worrying about your resume, I think is one thing, but like, in order to help other people, you have to make sure that you're okay yourself. And so figuring out what that means, like for me, it's still working out and rock climbing, like throw some headphones in and I forget about everything. It's like my brain just kind of turns off for a minute and I'm counting reps, or I'm trying to figure out the puzzle on the wall. So figuring out what that is for you, and it can truthfully be anything. And then just forcing yourself to make time for it. There are going to be times, as always, where, it's not going to work out this week, and, don't beat yourself up for not being able to take time. There are times where, you really got to hit the grind. Like step one and level one studying, I admittedly probably did not take enough self-time, because it was like, I really need to just sit down and hammer this out. But for the most part, taking time for yourself is like, you just have to force yourself to make the time.
Yeah, admittedly, I really was never good at self-care. And being kind of a type A personality, I had to have everything done at this time. I had to check off my to-do list. And if not, then it would be very difficult for me to go to sleep. But over time, and this happened in medical school when I had some personal challenges and really wasn't able to do a whole lot. I'm a big proponent of therapy, and I went for 2 years, and it's been the best thing that I've ever done and the best decision I've made for myself. Really changed my life around, really made me think about self-care, think about myself, how to, you can't pour from an empty cup. It's just impossible, especially when you're in a field of service. You need to, really step back and realize that if you cannot give your best, your patients are not receiving the best. So you're doing a disservice to yourself as well as for your patients. And so I really had to step back and learn how to take care of myself first. I kind of think of myself as wearing a hat when I go into a hospital, and as soon as I'm stepping out, it's off, and I'm not thinking about that anymore. I'm off. I'm with my family. I have 2 cats. I play with them. I have a husband. I spend time with him. I make sure that I carve out time for the people in my life, to do stuff that I enjoy, like the micro art or hiking, or it really is about carving that time out. And I've gotten much better at that. And it's the best thing to ask for help when you need it, so if therapy is what really will help you, or find your support systems, because this is a very long road ahead of us, and it's always going to be something to study for, something to work for. You're working very long hour shifts, but we have to realize that if we take care of ourselves, we take care of our patients much better.
First of all, thank you guys for both sharing that. Obviously, that's a more personal question. Yeah, it's almost not almost. It's very counterintuitive, given like the rigor of academia and the path they're all on. It's like when you tell someone you need to schedule your free time, they're like, "What? No, that doesn't work that way. I only have to schedule my studying." But it seems that that's the key. You have to make a constant effort to make that time for yourself, so that you can be better at school, at your job, at what may be. A shift here as a question, if you guys would like to share some of the most prominent opportunities or experiences you had with AMSA that you would not have had without AMSA.
So we're gonna keep coming back to it, but the first AMSA convention I went to, which used to be called AMSA Con and then is now Future Physicians for Change, was like the best opportunity I had in particular. So obviously, considering I'm going sort of more of the policy public health route, the first day of the AMSA convention is Advocacy Day, which when we're in DC, we do a whole training how to talk to lobbyists. We talk about a bill. The first year I went, it was the year the Affordable Care Act was under fire. So we learned about the Affordable Care Act, how it impacts patients, like a little bit more of the statistics, to be able to have a more informed conversation. And then they sent us off to Capitol Hill in groups to talk to our representatives. And I thought that was the coolest thing. Granted, I was a pre-med. I didn't have that much exposure to the Affordable Care Act or how it impacted patients. So I was a little bit like more observing for my first year. But I thought that was one of the coolest experiences. Like, I spoke to, being from California at the time, it was Senator Feinstein, and Mark Warner, weirdly, from Virginia. I just got thrown into that group. But I thought that was one of the coolest experiences. And like I said, at that conference, I met so many people that have helped me get through medical school. Many of them I'm still in contact with. I've crashed at a few of their houses when I'm like, hey, I'm randomly in Baltimore for a weekend. Can I sleep on your couch for a couple days? But I also can't, I think the biggest thing, especially as a pre-med, like the most important thing, like you can learn about the whole process, you can learn how to advocate, but then also like just the people component of AMSA, of like, I have people, like I'm putting together a guest list of like, for my own wedding, and like trying to figure out like, okay, who's from AMSA is going to come.
And it seems like everyone's from AMSA and nobody else, right?
Right.
You don't have any other friends.
Right.
Admit it.
It's true. Luckily, my fiance also has a lot of friends outside of medicine. But anyway, so yeah, being able to like find the people, have that like personal connection of like, you know, what we're trying to do is a difficult thing, and being able to like relate with those people on a very personal level, and then like go have fun and go out to bars with them. But then also like the networking piece from a professional setting, like all of the people that you meet there, or at least most of them, are going to end up being medical students or already are medical students and are going to be attendings by the time you're a medical student. So having those connections can go a very long way. I know several people who, through connections, both through AMSA, but also like through their own schools, where they're like, hey, I really, really want this rotation. And I know you were a resident at George Washington. Like, can you help me like just get an in or put in a good word? And they got those rotations. And, you know, like any time with networking, like the goal is not necessarily, at least in medicine, is not to give you the job. Like very few people are going to be able to say, yes, I'm going to give you a residency slot, partly because that's, I don't know if illegal is the right word, but it's not allowed. But they can get you in the door where it's like, hey, this person, like I know them really well. They're an excellent person. I think they're going to be a good physician. They take another look at your application. They're like, you know what? I think they're right. Like, add this new information, like helps give you a rotation. And then on that rotation gives you the opportunity to impress them. And so it's really all about just like opportunity. And so being able to network and look at people who you've met through AMSA or through anything, and not being afraid to ask, like, hey, I have a huge favor to ask, like, can you help me get this rotation type of thing? So I think the networking and just sort of like the human component of AMSA, on top of Advocacy Day, which it's still my favorite day of AMSA, are some of the biggest opportunities, I think, for pre-meds.
Yeah. I kind of want to say all the same things that Michael just said, but I'll say my story just a little bit. So I joined AMSA through one of my friends, and I remember there was a booth. This was during student fairs, like activities, and there was AMA who were giving out like a bunch of books and stuff, and then there was AMSA, and I didn't know the difference between them. So I asked my friend, and she told me. She went into the history and explained what AMSA does and how, you know, we really do. We are very unapologetically progressive change, and that's something that I don't think really any organization can say, because we've just been champions in that field. So it was a very easy situation for me. So I joined AMSA, And some of the opportunities that I received, honestly, all my leadership positions in medical school have been through AMSA, whether it was being the chapter officer at my school or being the national leader at AMSA. And during convention, so I wasn't thinking about applying for the president position, but I went to AMSA convention and met a few people, some of my friends there who we worked together on a lot of advocacy projects. And they told me, and I was like, oh, I'm not sure. I really want to apply for residency. But those same friends reached out to me again, and it just made sense. This is something that I'm interested in, public policy. It's something that I studied. That was my MPH in, and I knew that was the route that I wanted to take. So this was going to be, a way for me to do that. So it became a very clear choice again. But that's what it is. It's AMSA builds on networking. It's about that face-to-face connection. People know who you are. People know what your interests are and help you out and try to connect you to the best of the best. As someone who wants to go into OBGYN and it being a very competitive field, I was told by my dean that, and they were telling this to everyone who's applying for OBGYN, that, maybe, there should be a backup as well, maybe internal medicine, maybe family medicine, something else. And I was told the same thing. So I was thinking, okay, well, I'll probably apply for OB and internal then. But the same dean later told me after my position at AMSA that, you've done a lot of good work here and they look at it holistically. I don't think you need to dual apply. I think you could just do OBGYN. So that was a big deal. So this is the kind of opportunities that really AMSA opens the doors for you guys. And it helps you. It not just helps you with networking, but it helps you figure out what your goals, what your passion is, and helps you and gives you the voice to advocate for those things. So yeah, me and Michael are very biased. We love AMSA. So
I know a good friend who was in AMSA and both in undergrad and medical school, and he said that he never has paid for housing for his medical school interview and residency interview because he always knew somebody there and he always was able to, they were able to be hosting. So I guess the only benefit is that you don't have to pay for housing when you travel.
That's one of the many, yes, for sure. Yep.
Yeah, and sorry, just one more note. I know Rohini and I have talked a lot about policy. I will say, if you're like, I don't care at all about policy, there are definitely other opportunities within AMSA. I think you're getting a little bit of a biased perspective from Rohini and I. But anything like we have some of our action committees are doing work with like community health centers. We have REACH, which is our race, ethnicity, and culture and health. They do a lot of work around DEI and anti-racism. We have a medical education team that's doing like a medical education's research project, MedEd scorecard, which actually will be helpful for you all to keep an eye out for. We're going to be grading medical schools on their curriculum. So you can actually see, how well they actually are doing when it comes to teaching DEI and anti-racism and how good their wellness is. But that was not the point. So anyway, I say that to say there are other opportunities. If your like policy is of no interest to me, I won't be offended, and I don't think Rohini will. But with that being said, if you do go the policy route, Rohini and I don't think Rohini's gotten quite as much as this, considering she's on day 12 of her presidency. But in the last year, I was invited to the White House and Congress like 4 times. I have a letter on my fridge that was a Christmas card from the Bidens and their 2 dogs, so I'm forgetting their names, Chief and Commander or something. I've like connected with like more emergency physicians that are also doing policy, that are doing all these amazing things. Dr. Alistair Martin, Dr. Rob Davidson, Shuhan He, like all of these people are people that I met purely through my work in policy with AMSA. Getting to go to the White House is very, very cool. So there are like, especially if you get heavily involved, if you're more, especially if you're in the DC area, just because there's a lot of stuff in the DC area, there are plenty of opportunities. Rohini's been planning a town hall with Senator Sanders and Warren.
And Representative Jayapal.
And Jayapal, that's right. So like opportunities like that, I don't know of any other organization that would have allowed me to do that, that would allow like members to attend a town hall with is Senator Sanders on it too, or is it just Warren and Jayapal?
No,
Okay,
it's Senator Sanders and Representative J. Paul. Yeah.
Oh, I don't know where I got Senator Warren. We work with her too, but
Yes, yeah.
anyway, so if you are interested in the policy route, that's a little bit added incentive if you get to do cool stuff like that. But if policy is of no interest, there are other very, very cool and other opportunities.
Definitely.
It seems as though a reoccurring theme, today has been really the importance of, interpersonal relationships and the human component. Even though you guys are, talking about what is seemingly very daunting topics, or these getting involved, but that we keep coming back to the same thing. How important it is to just have, talk about your experience, have the human component, and to advocate for what you see every day, and that translates and lends well to even the most seemingly daunting of gatherings, so on and so forth. And that's amazing, and it's very wonderful to have you guys here explaining that and showing that to us. Thank you.
Yeah, no, thank you so much for having us.
Yeah, this was fun.
Other question I have is, what other the leadership positions? How does one become a leader in AMSA? Both, mostly at the pre-med level.
Yes, and I apologize if you hear my dogs in the background. So typically we have leadership applications that'll open somewhere around November or so. It changes year to year, but generally speaking, we'll have applications that'll open in November that you can find on our website, and I will drop the link for where those will show up. So you can apply for any of the chair, coordinator, pre-med director, membership director, or the pre-med trustee. All of those are available to pre-meds, and the pre-med ones, the pre-med trustee and pre-med membership directors are exclusive for pre-meds. But so those will open sometime around November. We do currently have a few of them still open. I don't recall off the top of my head. I remember there's one on the environmental health team. But anyway, so if you're interested in any of those, I'm going to offer up Rohini as your contact point for that. So you can email Rohini pres@amsa.org, PRES @amsa.org. And we can sort of see if there's one position in particular that you're interested in for this year. That'll run from May to next April 30th. Then our leadership transition happens every May 1st. But if you're interested for future years and you apply sometime between November, we vote virtually. We have a House of Delegates where we elect all of our national leaders and vote on all of our resolutions. Our resolutions are essentially what AMSA stances are on and everything from healthcare for all to reproductive health to substance use disorder. I mean, it's like a 200-page document, but we update that every year. That anyone can add what they think AMSA should stand for, as long as you're a member, of course. But so anyway, those applications will open November, we'll vote in February, and then you'll start May 1st, and I'll drop the link for where those opportunities will, if I can push the right button, where those opportunities will be posted.
Yeah, and I would again really push for coming to Future Physicians for Change, especially because a lot of these positions that we're talking about, you can see them in action and what we're doing, all the work that we're doing. So let me just post the register link here. So I just want to talk a little bit about the different kind of registration. So we have the early bird registration that ends May 15th, which is at a discounted rate. And then we have, if you're not a member of AMSA, but would like to become a member and come to convention, we have something called a join and attend. That's another discounted rate. So you will not have to buy your 4 years of membership. And then you can also attend as a group, and that also comes at a discounted price. So look through whichever works for you guys, but if you want to see us in action, see what we really do, I think that's another great place to start. Get your feet wet, figure out what you're interested in, where you think your niche is, and then we can help you guys with that.
And we also have extra discount codes. That's a little bit of a competition. So I'm going to give you mine, which is EAF. I dropped in the chat earlier, but that'll get you an extra discount on top of the other ones.
Well, I'm gonna lose this competition.
I beat you to it.
Another question for you guys, in terms of for those people, maybe they're in the medical field, maybe they're respiratory therapists or nurses or PAs or NPs. If they're passionate about what AMSA, about their mission and their statement, what can they do? Not having been physicians or pre-med students, but want to contribute.
I'm gonna let Michael take this one too.
Yeah. So there are a couple ways. So anyone can join. We just changed the name, and I can't actually remember what the new join is, but it's like a supporting ally or something, community ally, where you can join and sort of be in the know of like what we're working on. But especially, I mean, in particular, if you're like a practicing PA or NP or respiratory therapist, and you have specific knowledge that you want to contribute, we're always looking for more people to help our students, help our members understand, if you're a respiratory therapist and you're an expert in asthma and how that can be treated and how you can affect the social and political determinants of health to impact asthma. Like we're always looking for people to sort of help, like give talks, come to convention and talk to medical students about it. If you have an organization that wants to partner with AMSA, I guess this isn't terribly relevant to this audience, although for PreMed CC, of course, that this counts. We have like booths and things like that we're always looking for more people. But yeah, I think the biggest ways, especially if you're an expert or you have an area where you want to help AMSA do any of the work we're already doing, even though we direct most of our efforts in the context of medical students and pre-meds, almost all of it we will incorporate like nurses. We did a lot of work around like the Inflation Reduction Act with nursing associations, with other physician organizations, with the National Association of Community Health Centers. So yeah, we do a lot of work sort of all over the place, and it's usually ends up being like slotting you into a specific work that we're doing.
Yeah, exactly. So anyone can be a member. To be a national leader, you would have to be a pre-med or a medical student. But yes, we would love allies. We work with different organizations, different partners all the time. And like I said, collective voices are very important. So we definitely would want everyone. Yep.
Excellent. So for those here today and for people who will be watching the recording, if there's one with your wealth of knowledge, one thing you think is the most important takeaway that anyone takes, from this wonderful conversation we've been able to have with you guys, what would you say it is?
I'm going to steal Rohini's is find what you're passionate about. I think that's sort of been the theme of what we've been talking about, but figuring out like the one thing that keeps you going, especially from a professional setting. If you're a good enough rock climber, definitely by all means do that. But finding what you're passionate about, whether it's substance use, homeless populations, reproductive health, women's health, transgender health, finding that niche and then figuring out who in the community is also doing work in that space and reach out and see if you can learn from them. Most people are going to be receptive to that. Not everyone, but that was another thing that sort of kept me, that I adopted as like an undergrad that is an expletive, but it's basically just do it. Of like, a lot of times I was like doubting myself of like, oh, I'm not really qualified for that. Like, would I actually be good at that? And then eventually I'd get to the point where I'd say like, oh, screw it, I'm going to do it anyway. And then it would work out and it would be like one of the best decisions. Actually, the AMSA presidency was one of those. I was like on the fence. I didn't know. I was like, do I want to take the year off? All these things. And then like a day or two before the deadline, I was like, you know what? Why would I not do this? Why would I not work on something that I enjoy? And so I put in my application and funny enough, lost the first election, but I tried again the next year. And then that was my past year. So, and it couldn't have worked out any better.
Yeah, the same thing about passion, but I would also say there's always going to be doubt. There's always going to be, people telling you that you can't do something. But it's really just about finding that inner voice in you that keeps you going, whether it can be a passion towards, health policy, or some sort of like another topic, global health, community and public health, whatever it is that you're passionate about. But find that voice that tells you that you can do it, and really hold on to that. And really taking care of yourself. I can't stress that enough. Really focusing on yourself, on your mental health. And that's the only way we can do more in this world, and give more of ourselves. Sorry, my cats are just walking all over, but that's the only way you can. So I would say if there's anything to take away from this, take care of yourselves, build yourselves up, and find what you're passionate about and keep going. And ask for help, whether it would be for advocacy, doing more, learning more about what you're passionate about, or just for yourself.
And join AMSA.
Yeah. Join AMSA and come to Future Positions for Change. You'll learn way more about all the different things that our leaders are doing, and everyone's doing incredible work. And I don't think, the 1 hour, 1.5 hour, I don't think we can cover the amount of work that AMSA is doing. It's the one and only reason I joined AMSA is because everyone's so passionate, and they're very, very invested in doing what's right and really pushing that forward. And it's just this is my tribe, and I know that, these are my people.
This is sorry, another question that I really would like to pose to you guys. Are there any core philosophies you use to motivate yourself? And I know we've talked about this a variety of times, but is there anything specifically that has kept you, like a mantra in your mind or an idea that has helped you on this path?
No, go ahead, Rohini.
Michael said, "Just do it," which I mean, that is in essence that what kind of was your core. He's like, "I'm just gonna do this thing." Like, that's it.
Yeah, that was what I was gonna say. Was, I mean, like I said, it actually has an expletive in my head. But yeah, that's sort of been the thing that's like, when I start to doubt myself, is like, why? What's the worst thing that could happen? If I'm overwhelmed in 3 months, then I'll be like, all right, I need to step back, and I can make that decision later. If it's like a job or in medical school, it's like, what the worst thing they can do is say no. Like, for most of those things, there's nothing they can say that, or there's nothing that's going to happen that's that bad. Like, being able to deal with rejection is one thing. But yeah, just do it. Thanks, Nike.
Yeah, there we go.
I would say that what I try to think about when I'm riddled with some self-doubt is everyone started where I start, and that means you don't know something, or that's one step and there's like 100 more steps for you to go, but every single one of us has started at this point. So it's okay, and it's just about going at it and keeping at it and going, I don't know what I'm trying to say, but going at it every step of the way. So that gives me a lot of hope, when I'm overwhelmed and I think that, oh, I don't know something, someone's better than me at this, they should be doing this. Everyone started where you started, where I started, and that's okay, and that's how we learn.
I think that's from Harry Potter.
Oh, I was gonna say that.
I love Harry Potter.
I was thinking like, this is Harry Potter. I'm reading the books right now, and I was like, this is perfect. And that was.
Honestly, I'm not even surprised. I'm such a Harry Potter fan. It probably just has embedded itself in me.
My next question was, are there any Harry Potter fans out there? Because if so, that is definitely a philosophy to take with you. It's literally every great wizard has started where you are now. So just as a student, right, where we are. I want to thank you both so much on behalf of everybody here and everybody who will benefit from being able to watch this recording. And it's been quite amazing to have you here. Very inspiring, very educational, and I think we're all better for having you guys having spoken here. So thank you so much.
Yeah, thank you for having us.
Yeah, thanks so much.
Thank you again for coming. Immediate past president Dr. Walls and President Siva, so we have it correctly.
Yeah.
Dr. Walls is the past, Siva's Miss Siva is the future, right?
What's that?
I said you are the past and she is the future.
Yes.
Or the present. The present, sorry. The present.
The
And we
future
have
is Annalise.
yeah, I was gonna say we have a wonderful president-elect.